Hey y'all, for today's yoga snack, I want to talk a little bit about the difference between clinical yoga therapy and yoga. As a clinical yoga therapist, a lot of conversations that I have are just explaining to people what clinical yoga therapy is. And so I want to hit a couple of high points in this video just to give some of that information. The biggest thing when I work with clients in a yoga or a clinical yoga therapy setting, it's based on how I approach them on the mat. So that's going to be the main factor. It's still yoga, but based on what I do is going to be very different based on the goals, the needs, and why they are coming in. If I have someone approach me and they're wanting just to have a better overall understanding of yoga so that they can better attend group classes, if they want to just have a better practice because they're just wanting overall health and the natural therapeutic benefits that yoga brings, and maybe just some good stretching and some strengthening, yoga is the route that I'm going to go. I'm not going to be taking notes on them. I'm not going to keep any sort of data on them. They can work with me as often, as little, however they want to. And it's just giving them a better understanding of alignment, breath and movement connection, but in a very more physical based approach that is through that lens of yoga. If I have a client come to me and they are trying to navigate a chronic thing, whether that is a physical, mental, or emotional condition, clinical yoga therapy is the route. So if someone comes to me because they have chronic pain in their right shoulder, clinical yoga therapy. If someone comes to me because they are navigating anxiety or OCD or depression, those are going to be a clinical therapeutic approach. And the way that I work with someone in a clinical setting is I first and foremost take a much more extensive intake with them. We do assessment. I'm keeping data and notes on them that is allowing me to keep referring back to that if need be, but it's also quantitative. So when I am working with them after a certain amount of times, I can also see have we made progression in these areas. There's a lot of different tools that we pull from as clinical yoga therapists. The other aspect that differentiates it is I'm giving them homework and at-home practices for them to do in order to help mitigate whatever that condition, that chief complaint that they are coming to me with, so that they start to create these practices and embody them in their own. So it's giving them tools that they can use to help when those issues start to flare up or present in a more stressful way. I hope that makes sense. It's just kind of a brief overview. Obviously, there's a little bit more involved with both, but yoga is therapeutic in and of itself. It's just more of how I am working with a client. If it's going to be more clinical or if it's going to be more yoga, the approach is going to be vastly different based on what their goals and their needs are. If you have any questions about that, as always, please reach out and I'll see you next time.